Gentlemen, let's talk about something most men over 60 experience, but rarely discuss openly. You're lying in bed. The moment feels right. Your partner is willing. The atmosphere is perfect. But your body isn't responding the way it used to. Sound familiar? Maybe you've noticed it's taking longer to achieve firmness. Perhaps the quality isn't what it once was. Or maybe you're dealing with complete unreliability, never knowing if tonight will work or not. This uncertainty creates anxiety, which makes everything worse, creating a vicious cycle that damages not just your intimate life, but your confidence and relationship quality. Here's the truth. Nobody tells you. Declining performance isn't just about aging. It's not an inevitable sentence you must accept. It's about blood circulation, vascular health, and tissue conditioning. And today, I'm sharing 3 powerful techniques you can implement right now in the privacy of your home, without prescriptions, without expensive treatments, without embarrassing pharmacy visits. These methods work because they address the root cause, getting sufficient blood where it needs to go, when it needs to be there. I'm not talking about quick fixes or miracle cures. I'm discussing legitimate, scientifically validated approaches that have transformed intimate relationships for thousands of mature men. Stay with me because what I'm about to reveal could change your life in ways you haven't experienced in years. By the end of this presentation, you'll have a complete action plan you can start implementing today. I'm Dr. Charles Bennett, and I've dedicated 30 years, 3 full decades, to men's sexual wellness, specializing in helping gentlemen navigate their golden years with confidence, dignity, and vitality. I've worked with everyone from corporate executives to retired veterans, from men in their early 50s just noticing changes to gentlemen in their 80s determined to maintain active, intimate lives. If you'd like a personal consultation to discuss your specific situation, you'll find my contact information in the description below. I offer both in-person and telehealth appointments to accommodate your preferences and schedule. Now, before we dive into these 3 techniques, let me explain something crucial that most doctors skip over. Something that will help you understand why these approaches work and why you should trust the process. Think of your intimate response as a sophisticated hydraulic system, similar to the brake system in your automobile, but infinitely more complex. For everything to work properly, you need adequate pressure, open pathways, healthy, flexible tubes, and proper triggering mechanisms. Remove any one component, and the system fails or underperforms. In medical terms, achieving firmness is fundamentally a vascular event, a blood flow phenomenon. Yes, hormones play a supporting role, and testosterone levels absolutely matter for desire, initiation, and overall drive. Your brain chemistry matters too. Stress, depression, and anxiety can sabotage even perfect physical health. But the starring actor in this performance, the make or break factor, is your cardiovascular network. Here's how the process unfolds in real time. Sexual stimulation, whether physical touch, visual imagery, or mental fantasy, triggers a cascade of neurochemical reactions. Your nervous system releases specific compounds, primarily nitric oxide, that relax the smooth muscle tissue within your penile chambers, the corpora cavernosa. Once this muscle tissue relaxes, the cavernosal arteries, think of them as specialized highways built specifically for this purpose, dilate significantly, sometimes expanding to several times their resting diameter. Blood rushes in under arterial pressure, filling the spongy erectile tissue. As the chambers fill, they expand outward and compress against the tunica albuginea, the tough, fibrous sheath surrounding them. This compression traps the blood inside by squeezing shut the small veins that normally drain blood away. The result? Expansion, rigidity, and capability. Simple biology on the surface, but remarkably complex engineering underneath. Now, when gentlemen experience difficulties, what we clinically call erectile dysfunction or ED, it typically means this hydraulic system has developed blockages, weaknesses, or coordination problems. Maybe the arteries can't dilate properly due to atherosclerosis, the same plaque buildup that causes heart attacks. Maybe the smooth muscle has lost flexibility due to years without adequate oxygenation. Maybe the venous compression mechanism fails, allowing blood to leak out as fast as it flows in. Maybe testosterone has dropped so low that the triggering mechanism never initiates. Usually, it's a combination of several factors working together. Modern medicine offers various solutions, and I prescribe them regularly. Medications like tadalafil or sildenafil that enhance nitric oxide signaling, amino acid supplementation that provides raw materials for vascular health, injection therapies that bypass some of these mechanisms entirely, even surgical implants for severe cases where nothing else works. These treatments have their place and have helped millions of men reclaim satisfying, intimate lives. But here's what excites me most about the three approaches I'm sharing today. You don't need to wait for problems to develop. You don't need to rely solely on pills that cost money, require timing, and come with potential side effects. The three techniques work on fundamental principles. If you're already experiencing challenges, these methods enhance your treatment outcomes, often allowing reduced medication doses or better results from the same dose. If you're still functioning well but noticing slight changes, they help maintain and even improve your current capabilities, potentially preventing more serious issues down the road. Prevention beats intervention every time, and maintenance costs less than repair. Technique number 1. Pelvic floor activation protocol. Let's start with the easiest implementation, something you can begin this very day without equipment, without gym memberships, without leaving your home, without anyone else knowing what you're doing. I'm talking about targeted pelvic floor conditioning. And gentlemen, this is a game changer that most men never discover. Now, before you dismiss this as something only women need to worry about, something for pregnancy recovery or aging bladders, listen carefully. Multiple clinical studies, particularly extensive research involving men recovering from radical prostatectomy, complete prostate removal, have demonstrated that systematic pelvic floor engagement dramatically improves erectile function, often restoring capability that seemed permanently lost. Why does this work? Because activating these muscles creates a pumping action, a rhythmic compression and release that draws blood into the pelvic region. Think of it like priming an old-fashioned well pump. Those first few pumps move the mechanism, create suction, and start pulling water upward. Your pelvic floor works similarly. More blood flow to your pudendal arteries means more blood available for your cavernosal arteries, which means stronger, more reliable firmness when you need it. The most effective exercise, and you've probably heard of it under various names like Kegel exercises or pelvic floor training, is what I call the pelvic elevator technique. But I've modified the traditional approach specifically for mature gentlemen based on 3 decades of clinical experience and patient feedback. Here's my protocol, step by step. First, find a comfortable position. You can do this seated in a chair, lying in bed, or even standing, though I recommend starting seated or lying down until you master the technique. Now, identify the muscle group. The easiest way? Imagine you're urinating and suddenly need to stop the stream mid-flow. That contraction you feel, that lifting sensation inside your pelvis, that's your target muscle group, specifically the bulbocavernosus and ischiocavernosus muscles. Here's my modification that makes this more effective than standard protocols. Instead of quick pulses or brief contractions, I want you to contract firmly, really squeeze, and hold for a full 7 seconds. Count slowly. 1 Mississippi, 2 Mississippi, all the way to 7. Feel the lift. Feel the engagement deep inside your pelvis. You might even feel slight activation in your lower abdominals. Then release completely for 3 seconds, allowing everything to relax fully. That's 1 repetition. Perform 12 repetitions without rushing, then rest for 30 seconds. During this rest, breathe normally. Shake out any tension. Then complete your second set of 12 repetitions. Rest again, and finish with your third set. That's 1 complete routine. Do this routine every morning after waking and every evening before bed. Schedule it. Make it non-negotiable. Treat it like brushing your teeth. Within 3 weeks, sometimes even sooner, most patients report noticeable improvements not just in firmness quality, but also in staying power, control over timing, and overall sensation intensity. By 6 weeks, the changes become dramatic for many men. By 3 months, this often becomes the foundation of restored confidence. The pudendal artery, one of your body's most important but least discussed blood vessels, runs directly through your pelvic floor. That area between your scrotum and anus, the perineum, or what some call the taint. This artery is crucial because it supplies blood to your entire genital region, including the penile arteries responsible for firmness. When you consistently exercise these muscles with proper technique and adequate intensity, you're essentially training your cardiovascular system to direct more blood flow through this critical pathway. Think of it as clearing and widening the irrigation channels in a garden. The water source, your heart, remains the same, pumping the same volume. But optimized channels deliver more water to the plants that need it. Same principle applies here. There's another benefit that mature gentlemen appreciate. This training also addresses urinary concerns, particularly that annoying dribbling after you think you're finished, and it can significantly improve ejaculatory control, helping you last longer when you want to. 2 common issues after 60, both improved with 1 simple routine. That's efficiency. Some men report results within days. Others need several weeks. But virtually everyone who sticks with the protocol experiences measurable improvement. The key is consistency. Missing occasional days won't destroy your progress, but sporadic effort produces sporadic results. Technique number 2. Lower body resistance training. Moving to our second approach, and this one surprises almost everyone when I first mention it. Leg training. Specifically, resistance-based lower body conditioning focusing on your quadriceps, hamstrings, glutes, and calves. You're probably wondering what your legs have to do with bedroom performance. The answer? Everything. And the connection is both hormonal and circulatory. Here's the science that changes everything. Your leg muscles constitute the largest muscle group in your entire body, representing roughly 40% of your total muscle mass. When you engage these massive muscles through resistance training, exercises like squats, leg presses, lunges, step-ups, and deadlifts, your body responds by increasing endogenous testosterone production. That's your body's natural hormone factory, primarily your testicles and adrenal glands, ramping up production in response to the demand you're creating. Higher testosterone translates directly to improved desire, better mood, increased energy levels throughout the day, enhanced muscle maintenance, better fat burning, and yes, significantly enhanced erectile capability. Testosterone is the ignition switch for your entire intimate response system. Without adequate levels, even perfect plumbing won't help because the desire to use that plumbing disappears. But that's only half the story. And honestly, it might not even be the more important half for erectile function specifically. When you perform compound leg movements with appropriate intensity, you're creating massive demand for blood flow to your lower extremities. Your cardiovascular system responds immediately by dilating arteries throughout your pelvic region and legs, rushing oxygen and nutrients to working muscles. Your heart rate increases, your breathing deepens, and blood pressure rises temporarily. All healthy adaptations. This repeated dilation, workout after workout, week after week, month after month, keeps these arterial pathways flexible, responsive, and clear. Arteries that regularly dilate maintain their elasticity far better than arteries that never experience significant changes in diameter. It's use it or lose it, applied to your vascular system. Remember those cavernosal arteries I mentioned earlier? They don't exist in isolation. They branch off from the internal pudendal arteries, which branch from the internal iliac arteries, which also supply your legs, buttocks, and pelvic floor. By training your legs intensely and regularly, you're maintaining the health, flexibility, and responsiveness of the entire arterial network serving your pelvic region. Now, I'm not suggesting you start powerlifting or training for bodybuilding competitions. Safety comes first, especially for gentlemen over 60 who might have joint concerns, balance issues, or other limitations. Here's my recommended approach that balances effectiveness with safety. Start with bodyweight squats, or wall-supported squats if balance is a concern. Focus on perfect form rather than depth or repetitions. Feet shoulder-width apart, toes pointing slightly outward. Controlled descent, keeping your knees tracking over your toes. Pause at your comfortable bottom position. Doesn't need to be deep. Then controlled ascent, pressing through your heels. Perform 3 sets of 8 to 10 repetitions, 3 times weekly on non-consecutive days, allowing recovery between sessions. As this becomes comfortable over several weeks, add light resistance. This could be holding light dumbbells at your sides, wearing a weighted vest, using resistance bands looped under your feet, or transitioning to machine-based leg presses that provide back support. The key isn't lifting heavy weights or impressing anyone. The key is consistency and progressive challenge, gradually increasing the difficulty as your body adapts. Include variety: squats one day, lunges another day, leg presses the third day. This prevents boredom and works muscles from different angles. Always warm up with 5 minutes of walking or gentle movement. Always cool down and stretch afterward. Listen to your body. Some muscle soreness is normal and healthy, but sharp pain means stop immediately. Your body adapts to regular stimulus by maintaining and improving vascular function, hormone production, and overall vitality. 3 sessions weekly, 30 to 40 minutes each, including warm-up and cool-down, produces remarkable results within 2 months. Technique number 3. Vacuum therapy device. Now we reach the most powerful tool in your home-based arsenal, though also the one that requires a small financial investment. The vacuum erection device, commonly called a VED, penis pump, or vacuum constriction device. Before you dismiss this as awkward, embarrassing, or something only desperate men use, understand that this represents legitimate physical therapy for your erectile tissue, recommended by urologists worldwide and covered by many insurance plans. The device consists of a clear acrylic or polycarbonate cylinder that you place over your penis while flaccid, creating an airtight seal against your body using a flexible ring at the base. When activated, either manually with a hand pump or with a battery-powered electric pump, the device creates negative pressure inside the cylinder, essentially creating a vacuum. This vacuum effect literally pulls blood into your penis through mechanical force, bypassing many of the physiological mechanisms that might be failing. It doesn't matter if your arteries can't dilate properly on their own, if your nitric oxide signaling is weak, or if your smooth muscle is stiff. The vacuum creates suction that draws blood in regardless of your natural capability at that moment, inducing an erection that can reach full rigidity. Once full engorgement occurs, you'll see and feel it happening. You maintain that state for 10 to 15 minutes. During this time, Your erectile chambers are fully expanded. Oxygenated blood circulates through the tissue, bringing nutrients and removing waste products. And the smooth muscle fibers experience beneficial stretching that helps maintain their flexibility. Multiple peer-reviewed studies published in respected urology journals confirm that regular vacuum therapy improves erectile function through several distinct mechanisms. And the evidence is compelling enough that this is now standard rehabilitation protocol after prostate surgery. First, it maintains tissue elasticity and prevents fibrosis. Just like any tissue in your body, erectile chambers need regular expansion to stay healthy and supple. Without frequent firmness, whether natural or mechanically induced, the tissue can develop fibrosis, essentially scar tissue formation, becoming less flexible over time. This creates a downward spiral. Less firmness leads to tissue changes, which makes firmness even harder to achieve. Vacuum therapy breaks this cycle by forcing regular expansion regardless of natural ability. Second, the therapy improves both venous return and arterial flow patterns by exercising your vascular system. By repeatedly filling the erectile chambers to capacity, you're training your cardiovascular system to deliver blood more efficiently during natural arousal. Think of it as physical therapy for your arteries and veins. Third, it provides significant psychological benefits that shouldn't be underestimated. Successfully achieving firmness, even mechanically assisted, reminds your brain that the capability exists, that your body can still perform, reducing the performance anxiety that often compounds physical challenges. This confidence boost alone can improve natural function because anxiety is a major contributor to erectile problems. Fourth, and this is fascinating, regular vacuum therapy appears to improve oxygenation of penile tissue even outside of therapy sessions. Better oxygenation means healthier tissue, which means better natural function. Some studies suggest it might even help prevent the penile shrinkage some men experience with age or after prostate surgery. Here's my recommended routine for mature gentlemen, refined over years of patient feedback and outcome tracking. Use the device every other day, not daily. Your tissue needs recovery time between sessions. I recommend morning sessions because that's when testosterone levels peak naturally, and you're fresh rather than tired from the day. Apply water-based lubricant to the cylinder opening for a better seal and more comfort. Place the cylinder over your flaccid penis. Press firmly against your body to create the seal and activate the pump gradually. Never rush the pressure increase. You should feel pulling and expansion, not pain. If anything hurts, release pressure immediately. Pump until you achieve full rigidity, then maintain that pressure for 12 to 15 minutes. Many devices have pressure gauges. Don't exceed the recommended maximum for your device, typically around 250 millimeters of mercury. Set a timer so you're not guessing. During these minutes, you can read, watch television, or just relax. Some men use this time for meditation. After the session, slowly release the vacuum pressure. Remove the device, and you're done. Some systems include constriction rings, elastic or silicone bands that you can transfer to the base of your penis after pumping, allowing you to maintain firmness for intercourse by preventing blood from draining back out. While this works well for some couples and is perfectly safe when used correctly, I primarily recommend the device for therapeutic maintenance rather than as a pre-intercourse routine. Most patients notice improvements in natural function within 6 to 8 weeks of consistent use, though some respond faster and others need 12 weeks. The effects are cumulative. The longer you maintain the routine, the better your baseline function becomes. Some men eventually reduce frequency to twice weekly for maintenance once they've achieved their goals. Always start with lower pressure settings and increase gradually over several sessions. Excessive pressure can cause bruising, burst capillaries creating red spots, or even more serious tissue damage. If you experience pain, stop immediately and don't resume until the next scheduled session. The sensation should be pulling, stretching, and fullness. Never sharp discomfort or throbbing pain. Men taking blood thinners, aspirin, warfarin, Plavix, or newer anticoagulants should consult their physician before beginning vacuum therapy because you're at higher risk for bruising. Similarly, men with certain blood disorders should get medical clearance first. Never use a device without the proper seal ring, and never use household vacuum cleaners or improvised devices. Medical-grade VEDs are specifically engineered with safety mechanisms. Improvised devices can cause serious injury. Gentlemen, you now have 3 evidence-based techniques that address erectile function through improved blood flow from different angles. Pelvic floor activation for targeted circulation enhancement and direct penile muscle strengthening, lower body resistance training for systemic vascular health and hormonal optimization, and vacuum therapy for direct tissue conditioning and mechanical capability. Implement all 3 for maximum benefit and synergistic effects. The pelvic exercises take maybe 10 minutes daily total, less than the time you spend checking email. Leg training fits into 3 weekly sessions of 30 to 40 minutes each, time well invested in your overall health beyond just intimate function. Vacuum therapy requires 15 minutes every other day, a small commitment for potentially transformative results. Total weekly time investment? Less than 4 hours for potentially life-changing improvements. Compare that to the time you spend watching television or scrolling through your phone. This is investing in your quality of life, your relationship, your confidence, and your masculine vitality. I've also developed specific nutritional protocols featuring foods rich in natural vasodilators, compounds that relax arterial walls and improve circulation throughout your body, not just your pelvis. You'll find detailed information in another presentation on my channel, including a specific smoothie recipe combining watermelon, pomegranate, beets, and other ingredients that many patients swear by. The science behind food-based approaches is solid, and dietary changes complement these physical techniques beautifully. Additionally, I have presentations covering testosterone optimization through natural methods, addressing performance anxiety and psychological factors, and discussing when medication becomes necessary and how to use it most effectively. Remember, this information serves educational purposes only. It does not replace personalized medical evaluation by a qualified healthcare provider. If you're experiencing concerning symptoms, persistent difficulties, sudden changes in function, or have underlying health conditions like diabetes, heart disease, or neurological issues, consult a specialist before beginning any new regimen. Every man's situation is unique, and professional guidance ensures safe, effective approaches tailored to your specific needs, medical history, and goals. What works perfectly for one gentleman might need modification for another. That's where individualized care becomes invaluable. Your intimate life doesn't have to decline with age. That's a myth, a cultural assumption we've accepted for too long. With the right knowledge, consistent implementation of proven techniques, and professional guidance when needed, your 60s, 70s, 80s, and beyond can remain vibrant, fulfilling, and satisfying for both you and your partner. These 3 methods, pelvic floor training, leg resistance work, and vacuum therapy, address the fundamental issue of blood flow from multiple angles. Combined, they create a comprehensive home-based program that costs minimal money, requires moderate time commitment, and produces results that many men thought were impossible without medication or surgery. Start today. Pick one technique and begin. Add the second next week. Incorporate the third when you're ready. Build momentum gradually, stay consistent, and track your progress. Many men notice changes within weeks. Almost everyone sees improvement within 3 months of dedicated effort. Until next time, this is Dr. Charles Bennett reminding you that your wellness is worth the effort. Your intimate life matters at every age, and you have more control over your vitality than you might believe. Take action, stay committed, and reclaim the confidence that's rightfully yours.